of the trauma case managers with the trauma department. Today we're going to talk about PTA and Optus. As you've probably noticed that we're recording the session, it's because it's being recorded for my course that I'm doing with Open College.
Are we recording again?
Does anybody know what PTA is to start off with?
Parent Teacher Association.
No, I'm just kidding. Good one. Anyone else?
Parents Teachers Association.
Sorry. No? PTA is post-traumatic amnesia. Does anyone know what that means? Yeah?
Forgetting what happened, whatever. Brought you to the hospital.
Yeah, so it's an amnesia associated with a post-traumatic event. What's a traumatic event? It could be a car crash or many other things, which we'll have a look at in a second. So today we're just going to be talking about the definitions of head injury and what amnesia is. We're also going to be talking about just GCS, really a recap, because I'm hoping you all know how to do a GCS already. And just talking a bit about what PTA is and an overview of how we do testing for it, and a WOPTUS, which is the abbreviated PTA score, and what the nursing implications are for that. So, as we said, there's lots of different types of mechanisms in trauma, and it's really important to know the mechanism in trauma because it gives us an idea of what type of injuries a person might have. Okay, so for example, person falling off a roof, being hit in the stomach with a skateboard, could have spinal injuries from that landing, could also have abdominal injuries from the surfboard landing on him. Different types of head injury. We've got closed head injury versus open head injury. As you can see from the pictures there, they're good examples of what open head injury is. They're obviously very obvious ones. Other open head injury might not be so obvious, but what it means is that the skin is open and there's a fracture there and it's open to the meninges. And a closed head injury where it doesn't penetrate the skull. A loss of consciousness is any state of impaired consciousness, really, where they may have no response to the environment. Why is it making that noise? So, what's amnesia? We've got two different types of amnesia. Like you said, that they're going to forget what the amnesia is, forget the incident surrounding. So if they've forgotten things before the incident, before the traumatic event, then that's retrograde amnesia. If they're forgetting things that have happened after it, then it's anterograde. And people in PTA can continue to have that loss of memory and are unable to be storing new information. So, all of us are happy with what a GCS score is? Yes? PTA are incorporate the GCS, so GCS is actually part of those scores. So, like we said, what's PTA? So they have, someone in PTA will have trouble forming new memories. So we'll give them something to remember and they won't be able to remember. For example, like what you said, why they're here. Somebody might come in with prepared for questioning to the emergency department and keep saying, why am I here? What happened? Why am I here? Why am I here? It's quite common. And we can tell a lot about the extent of their brain injury by how long that lasts. Orientation ahead, so they might not know where they are, what day it is, what time it is. So, post-traumatic amnesia testing, symptoms vary a lot, but during that time they can have anything from headache, anxiety, depression, not forming new memory loss like we said, feeling really tired, and also the swapping of day and night and having that confusion, poor concentration, and difficulty in problem solving. A CT may show a bleed like this picture does here. This is a subdural hemorrhage in that picture. they don't need to have anything show up on CT for them to have a concussion. Okay? It could be completely normal and they can still have a concussion and be in PTA. So whenever we've got someone who's had a hand injury, we like to try and keep them as calm as possible. Try and give them a routine as well. So do things in certain order so that they know what's happening. Some sources will advise on doing what we call cluster care, so doing things, so go into the room, do everything you need, and then come out and let them rest for the rest of the time. Don't keep interrupting them every hour to do your nursing jobs. They've cleared our PTA post-traumatic score, and they need to stay supervised. They shouldn't be leaving the ward by themselves. This is what the actual form looks like. And as you can see from the questions there, so we ask them just things about orientation. So how old are you? What's your date of birth? What year is it now? What month is it? Where are we? And they have to be specific in the answers, like you're at St George Hospital, not we're just at Cobra. And then we give them some things to remember. So one of the things that we give them to remember is a face and that person's name. And then the next day they'll have to remember who that person was, choose them out of 3 people and remember what their name was. And we'll also give them 3 picture cards and say to them you need to remember them for the next day, and that's testing their ability to form new memories. So like I said, new memories, where they are and the time. To pass PTA, you need to get 3 days in a row of getting 12 out of 12. So you need to get all those questions about orientation correct, plus all the questions about the memory questions as well correct, and you need to do it 3 days in a row, and each day in a row for them to be cleared from PTA. So someone might be in hospital with a concussion and be in hospital for 4 days just to get PTA testing. The reasons that we do it is because, as I said before, it gives us an idea of how bad their head injury is. If someone is continuing after 10 or 12 days to continue to have decreased scores on their PTA, it means that they probably need outpatient referral to a brain injury unit or more supportive measures after discharge. And it's also a guide for rehabilitation. It might be that they also need inpatient brain injury unit rehab. And it also gives us an idea of how much they're remembering, how much we can tell them to do, to education and things like that as well. So duration can be, like I said, very short to very long. So some people might, in the emergency department, come out of PTA because it's only lasted an hour, and then they're starting to remember things and what happened. And I don't mean they might remember the incident, I just mean that they might start forming new memories. Some people who have lost consciousness will never remember that incident. They might never remember the before and after. So that's the scale. Some people might score poorly on their PTA, and it might just be from other issues, and it could be that they've had a long history of drug and alcohol and abuse, and that's affected their normal brain function, or they might have some other neurological problem, and so in those cases we wouldn't do a PTA and they would need to clear them. So inclusion criteria, we're looking at, they need to have a closed head injury, and there needs to be some amnesia reported, or a loss of consciousness, or something, cerebral pathology on CT, so either a bleed or a skull fracture or something. We don't do it for people over 70 or under 7, and we don't do it for open head injuries or non-related to trauma.
Why don't you do it on people over 70?
Because they've just that they're gonna, that they're not gonna ever pass, and so we use other tests for them, and the occupational therapists are the ones that do those.
I was wondering how do you get cleared if you're over 70?
Yeah, so there is other tests, but not, like so like the MMSE, like the cognitive assessment, those types of things.
So this test is just like the standard.
Yeah.
So between
770 people.
Yeah. So when to start, we started as soon as they're conscious and they can communicate. So if someone's been in ICU, we'll wait till they get to the ward before we start it. If they have, sometimes people might have a trachea, doesn't mean we can't start it. As long as they can write with pen or point to answers and things like that, we can still start. Any of these people can request it. During the weekdays, occupational therapists, and on the weekends, the trauma case managers do them. And as I said, it takes 4 days, and as you can imagine, they've blocked all these other things. So what they've done to help that is to introduce the abbreviated Westmead PTA. Abbreviated Westmead PTA is almost exactly the same, except it's done over 4 hours instead of 4 days. If by 4 hours they've cleared a WOPTIS, then we don't need to do it anymore. If they haven't, then they need to be admitted and get formal PTA testing. The ED nursing staff have been trained in doing the WOPTIS, so you might see the form in their notes if they come up from ED with saying either cleared or, and I'll show it to you what it looks like now. So the idea of bringing out the abbreviated is it decreases the length of stay and avoids a ward admission if they don't need it. So very similar inclusion criteria, but with the WOPTIS we can't do it with anyone who has a documented cerebral pathology on CT. They need to have a clear CT to be able to pass a WOPTIS. And we'll start it for just about anyone really, so even if it's just a mechanism, you know, they've fallen 4 metres, they've landed on their head, they're a bit vague, no really reports of LOC, no reports of amnesia or anything, but we can still start it. It's quite easy test. We're doing a GCS anyway. There's only 3 extra questions. And very similar exclusion criteria as well, except for the CT. That's what the form looks like. So the top bit is basically a GCS, except in the orientation part of the GCS, it's very specific as to what questions you need to ask, and they need to get all of them right to score a 5, which is what I love about it. Because with a GCS, you could ask something, you could ask something else, you could ask something else, and we'll all give them a 5, but someone might give them a confused and someone else might give them a 5. So this is more specific. It actually asks, they need to know their name, the place, why they're here, the month and the year to get a 5. Okay. And then the rest is the same, verbal and eye-opening. It's also got bits on there for pupil assessment, it's also got bits on there for limb assessment, like a normal GCS. The only bit that's extra is that we'll give them 3 cards to remember, the cup, the keys and the bird, and we'll say to them we'll come back in an hour and ask you what those were. In an hour's time, redo a GCS and ask them what the cards were. If they've scored an 18, so they need to have a GCS of 15 plus the 3 cards, 18. Just one time, that's it, they've passed their PT, their WOPTIS. They're picture cards as well that we show them. Reset all that. So if they've got a confirmed traumatic brain injury, then we will cease PTA, WOPTIS and go into PTA. We can also pick up deterioration in the WOPTIS, very similar to a GCS. If you've got a drop of 2 or more points, then you would seek help. Or if they've got a persistent GCS of less than 15 at 2 hours, we would consider doing a CT earlier. These are the people that will get admitted to the ward. So if they've, like we said already, if they've got an WOPTIS of less than 18, or if their GCS is below 13. On discharge, everyone needs to be given, anyone with a closed head injury needs to be given head injury advice. And there is within the protocol, there is a printout of head injury advice. It's also available on the Motor Accidents Authority website in multiple languages. So if you have a patient who has speaks a different language and is being discharged with a head injury, that it is possible to give them head injury advice in their own language. We also need to make sure that people are going home with a responsible adult. We don't want them to go home to somewhere by themselves and potentially have symptoms or something that will need them to come back in for, but they won't be able to pick them up. Things that we want them to come back for are things like seizures, persistent vomiting, any sort of abnormal behaviour as well. It is quite common after any concussion to have a headache and a bit of nausea for a little while, but if it is quite severe and they can't handle it, then we welcome them to come back or to see their GP. Don't worry about that. It's ED. Anyone got any questions? Yeah.
When we perform an actual PTA, is there any room for error? Like if it's the 23rd and if they say 22nd, or they don't say the date?
We don't ask for the date, we ask for the day and for the month and the year, and there's no room for error. They need to get them all correct. They can say, I don't know, we can give them an option, so, is it March, May, June, for example, or whatever, and they can choose one of them, if that can be a prompt, but we can't correct them. Yeah. We can correct them afterwards and tell them this is the correct orientation, but we don't do it.
And patients who've forgotten what was the incident that's happened, usually would they eventually recall it, or it's always gone?
No, it's always gone. They'll remember people telling them what happened, but they won't remember the actual event. Very rarely. Sometimes people will start getting flashbacks, but to remember the whole thing, it's not very common. Did you have a question? No?
Where can you find the head injury instructions, post instruction? You said there that we must give patients.
Oh, okay. Usually either the trauma case managers or the OTs will give it to them, but you can find them on their MAA website or on the intranet, on the hospital intranet, in the protocols. There's a mild head injury advice protocol, and it's in there under trauma. Thank you.
Thank you.